So one interesting issue is that I think that there may sometimes be a discordance between an oncologist's view and a patient's view, in that at least we need to try to work towards a similar perspective about things like short-term versus the long game. Fortunately, lung cancer now often has multiple opportunities to treat and have effective therapies. And so I am not thinking just about the first treatment as the only treatment, but trying to think more and more about what can we preserve as an option for later and what makes sense as a sequence, which is a great luxury to have compared to where things used to be. You need multiple potentially effective options to have to worry about sequencing them. So I think it's really important to highlight that there is an option here. We will hope to get as much benefit as we can from that, but also to outline, and then after this, we can think about another thing or another thing. And just to know, I think one thing I observe is that a lot of patients, even when they're doing well, are thinking about what would happen next. And I know you can speak to that. But I think it's also important to highlight that we certainly want to get as much tumor shrinkage as we can initially, but to me it's more about the duration than what one scan shows. And oftentimes patients after an initial shrinkage will have stable disease, which to me is a victory. I'm very happy to have patients not progressing. It's great to watch it shrink and watch it shrink more, but if patients are doing well after initial shrinkage, we will celebrate every stable disease scan as a victory lap. Can you talk about what it's been like to, you have the fortunate position of having some historical perspective here, to think about your cancer as a sequence, and was that initially where your mind was?
Initially, my mind was all over the place.
Okay.
It took a while to get my brain wrapped around everything, having 4 young kids and a husband. Yeah. My first scan after I started my Tarceva showed all my seeds were gone. And that was, I remember my doctor running out in the hall to find my husband and call him in to see it. And so that was a victory for me.
Yeah.
And then, over time, by the time I got to see you, they were progressing a little. And it's sort of a roller coaster ride, but as you put it, it's such small progression. And I look at it as like chronic. I've got a chronic condition. I don't have a terminal condition, I have a chronic condition. And I'm finding a way to live with it.
And I think you bring up a really good point as well, that this concept of response on scans is a continuum. It is not a binary, it's good or it's bad. We are thrilled to see a nice shrinkage. As I said, I am happy, and I think over time you also have been very happy to have scan after scan over time show stability.
Yes.
A few months here, several months there, it adds up. But even the concept of there being a bit of progression, and I think that is an important issue as well, that there can be a distinction between progression that you have to squint to see and clinically significant progression, because you had an occasional scan with a nodule or two or a few that were slightly larger, but you had to squint to see that. And I reassured you, and I hope you were truly reassured, that this was okay, because you had other scans after that showed no change, and we probably went a year or more after the first hints of progression to really needing to change that. So I think that's an important thing for people to learn, that just because a radiology scan report says some progression seen, you have to put that in the context of how much that really means to and you didn't have any symptoms either.
No, to date have not had any symptoms.
Well, that's a blessing.
But
that's
yes,
great.
and like you say, all my progressions, you've told me you got to squint to see.
Yeah.
So I haven't had any big jumps, which has been great.
How much does it mean to you knowing that there are other options waiting in the wings?
Oh, it gives me so much hope.
Great.
It's a total different outlook on life than I had in my first few weeks. I can say that.
Excellent. Thank you.